Hey guys, welcome back to Nurse Katherine here, and welcome back to my YouTube channel. So as some of you may know, I have made a career change. I spent 3 years working in med-surg nursing, and now I am currently in orientation for emergency room nursing. So I was thinking to myself today at work, as I'm still in my scrubs of course, I just got back from work, and I wanted to talk to you all about the differences between a med-surg nurse and an emergency department nurse, and the difference of what the nurse can actually do and the patients that you're seeing. So here we are, and let's talk about it. So let's start with the med-surg nurse. So I wouldn't say a lot of experience in med-surg nursing, as it was only 3 years of nursing, but I had a good amount of exposure to med-surg nursing in 3 years, I would say. So in med-surg nursing, you're more so doing your head-to-toe assessments at least 2 times a day. For me, that was because I worked 12-hour shifts. So you have your head-to-toe assessments, you have your morning, your afternoon, and your evening pills. You're making sure the patients are getting bathed for the day, whether that's you doing that or the nurse aide doing that. You're making sure their chem sticks are being checked. You're helping plan discharge for them, making sure everything is set up there with case management. You're also making sure physical therapy is involved, and whether they need physical therapy at home or whether they need rehab. So it's a lot more planning, I would say, rather than acute care. It's just making sure they're more so stabilized and getting better to transition to home. You will occasionally get your patient who's declining and you will have to send them off the unit. But for me, that didn't happen too often. It did happen, but not like every single day. You're dealing with a lot of hospice patients, at least I was. Some withdrawal patients, people in the hospital for long-term antibiotics. Those are the type of patients you're seeing in med-surg. And the train of thought is very much like what I said. It's a lot of planning. Planning for this patient's future. A lot of education about what will keep them out of the hospital, that sort of thing. But with emergency room nursing, I have struggled a little bit, not going to lie, because my train of thought has to change. So with emergency room nursing, which I've only had 3 weeks of experience so far, so I'm comparing 3 years to 3 weeks. So of course I will be the first to admit I do not know everything about emergency room nursing, but I can talk about the general gist of what I have seen. So with emergency room nursing, it's a different way of thinking. It's very disorganized, organized thinking, if that makes sense. So you're treating the acute problem right then and there, and you're not really worried about educating the patients, whether that be like diabetes education or heart failure education, because you're trying to treat the acute problem going on, that you're not even focused about that unless you would be discharging them at some point. And even then, I've noticed the education kind of lacks with discharges, because you are timed with your discharges in the emergency department. At least we are at the hospital I work at. And once the doctor prints the discharge papers, you have 25 minutes to get the patient out of there. And in med-surg, I have spent 25 minutes going over diabetes education alone. So that tells you kind of right there the difference of the education and the preventative medicine, I will say. My way of thinking, like I said, had to change in the emergency room. So I'm not thinking really about the full head-to-toe assessment. I'm not really checking for decubitus ulcers on the bottom unless that's a primary problem or we can't find an infection somewhere. I'm not doing head-to-toe skin assessments on every single patient. Some patients, I don't even listen to their lung sounds, which is crazy to me, but some patients you just don't, because they're there because they fractured their arm. So you're not going to listen to their lung sounds, of course, unless it was like a trauma. But it is a very different way of thinking. So I would say emergency room nursing and med-surg nursing cannot be compared by any means. And I would never be one to say that, oh, you work in the emergency room, that's not real nursing. Oh, or you work up on the inpatient side, that's not real nursing. Because there is no such thing as real nursing. Nursing is nursing, whether that's in an office or med-surg or emergency room. It's just the way of your thinking is totally different wherever you are. Even if you're in a nursing home, it's a totally different way of thinking. And I would also say in the emergency room, there are a lot more resources for nurses, and I have noticed more teamwork in the emergency room, whether that be from other RNs or your nurse aides, your medics, the doctors. I found a lack of communication with the plan because it's more so just in notes and you have to make sure you read the notes to understand what's going on. But I would say the teamwork is 10 times better. And I hope that doesn't offend anybody, if anybody I have worked with is watching this video. But I would say the teamwork is definitely stronger in the emergency room. And that's, I don't really know why that is. I would have to say possibly because of how acutely sick those patients are. And of course you don't want patients to suffer. So it could be that. But yeah, I would say teamwork is definitely stronger. I have enjoyed the emergency department. I think I needed a bit of a change, and it's new and exciting for me, so I'm really enjoying that. But that's also how I felt going into med-surg nursing when I was a new grad. I was super excited about it. Felt like I was going to kill my patients for the first year because I wasn't confident. But that'll go away. If you're a new grad here and watching this, that'll go away. That feeling will go away. But yeah, I think they're a little hard to compare because it's a different way of thinking and it's a different way of taking care of a patient. I wouldn't say one is better than the other, but as of right now, I'm enjoying the emergency room much more than I was enjoying med-surg nursing in the last year that I've been working. And that's it for this video, guys. Thank you for watching. Thank you for coming to my channel. Make sure to subscribe, hit that below, hit the subscribe button, hit the bell button, get notified of new videos coming out. Big alert for you guys. I will not be posting 2 videos a week anymore because I need to pick up overtime because I have student loans. Yeah, so every Tuesday I will be now posting my videos for the week instead of Tuesdays and Fridays. I'm sorry, guys. But if I want to keep doing this, I need to pick up some more overtime. So, yes, so once a week on Tuesdays my videos will be coming out. But other than that, guys, I will see you next week. Make sure to comment below. Tell me some of my oh my goodness. Tell me some video ideas that you would like me to touch on, especially if you are in nursing school. If there is something that I have not touched on in the past, or you would like me to repeat more, or kind of go on a different avenue of that subject, whatever it may be, just comment below and I'd be happy to make more videos for you guys. And yeah, that's it. I hope you all have a blessed day, and I will see you in next Tuesday's video. Adios!